Good morning, everyone. I'm Lindsay Goldfarb, Director of Healthcare Education at Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insights Series webinar. MHA is excited to resume one of our most popular series, which features candid interviews of hospital leaders and will continue throughout 2021. Today's theme is aptly named Leading an Alliance. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have any questions during the webinar, please feel free to type them into the chat box. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I'd like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's educational programs. In particular, I'd like to thank today's program sponsor, e-Ink. A valued supporter of MHA, e-Ink is a pioneer in e-paper technology and digital displays. Now I'll hand it over to Tim O'Malley, AVP for the U.S. Regional Business Unit from e-Ink, to say a few words. Tim, over to you.
Thank you, Lindsay. e-Ink is honored to sponsor this session of the Executive Insight Series. e-Ink is a technology company founded here in Massachusetts, spun out of the MIT Media Lab. It's pioneered the invention and the use of digital paper. We're passionate about improving the availability of information with a healthy and sustainable solution. You may know us from the Amazon Kindle, some of the signs around Boston, such as Government Center, Kendall Square, or the Invented Here plaque in Logan Airport at Terminal C. We're bringing our digital paper to hospitals and healthcare via digital whiteboards and e-note solutions. Our digital whiteboards marry the visual appearance of a whiteboard, so it's reflective, easy to read, has no blue light, and it's low power, with the accuracy and labor saving of connecting it to your EMR. It can be your whiteboard that is always up to date, translated to the target language, and has no need for anyone to remember to write it or erase it. We have a pilot program and a real desire to work with Massachusetts hospitals to demonstrate these advantages. If you're interested, our contact information will be shared at the end of the webinar, and we'd be thrilled to speak to you about it. And now it's my pleasure to turn it over to your moderator, Steve Walsh, President and CEO of MHA. Thank you.
Thank you, Tim, and thanks so much for sponsoring this morning's session, and thanks for sharing a little bit about an exciting technology that can improve the experience for patients and for our members. And thank you, Lindsay, again. And it's great to be back this morning for our 7th episode in our Executive Insights series. I hope you had a safe and restful summer. Over the first 6 installments of Executive Insights, we've learned an incredible amount about our healthcare leaders here in Massachusetts, their journeys, their motivations, and their advice to the rest of us. Today, it is our pleasure to continue this dialogue with one of the brightest minds in community healthcare, Dr. Assaad Sayah. Dr. Sayah has been Cambridge Health Alliance's CEO since January 2020. Prior to that, he served as Chief Medical Officer since 2013 and was Chief of Emergency Medicine and Senior Vice President of Primary Care at CHA. Dr. Sayah's leadership has been a critical component of CHA's growth and success over the past decade. In the emergency department, Dr. Sayah led significant advancements at all 3 CHA hospitals, resulting in enhanced efficiencies, quality, volume, and patient satisfaction. He spearheaded primary care growth by more than 50%, expanding CHA's access in underserved communities. Dr. Sayah received his medical doctorate from the University of Massachusetts Medical Center and completed his residency in emergency medicine at William Beaumont Hospital in Michigan. He is also a valued member of MHA's Board of Trustees. Dr. Sayah, thanks for joining us and welcome.
Good morning, Steve, and thanks for inviting me. It's a pleasure being here this morning.
Well, thanks. And I know the audience is going to appreciate some of your story and background. To start us off, we'll start at the beginning as we normally do. Why'd you get into healthcare? And then, even more importantly, once you were such a successful and critical doctor, what drove you from the clinical sphere into the leadership realm of healthcare?
Yes, I don't remember a time where I thought about being anything else but a physician. I grew up in Lebanon, and I'm a sort of a product of the Lebanese civil war. As a child of a sort of a middle-income family, neither of my parents finished high school. None of my extended family even finished college. So, I was a pioneer with my own family and my own community. And what my parents instilled in me as a child is the importance of work ethics, being out there, going the extra mile, doing what you need to do to really be very supportive to the community around you. Volunteered a ton when I was a kid. Because of the situation in Lebanon at the time, the opportunity to really grow in the professional field, I was in high school at the time, it was very difficult. And I ended up immigrating to the United States at the age of 17 after finishing high school, with no family, no money, and no English. And through a lot of support from many people that I did not know, I met as somebody who's new in this country. I succeeded, and here I am. So it's a very unusual story, but it's really a story of the American dream, and the opportunity that this country provides to anybody that really believes in being out there, being supportive of the community, and improving themselves with the appropriate work ethics. What drove me into emergency medicine is, and I didn't know about emergency medicine as a child, is a couple of things. One, I'm an adrenaline junkie. Anybody that knows me knows that I have more energy even at the age of 60 than a lot of people have my age. You saw me sipping a cup. There's no caffeine in it. If I have any coffee or any caffeine, I'd be up for days. So plenty of opportunities there. So being an adrenaline junkie, the pace and the speed of emergency medicine really appealed to me. But more importantly, emergency departments are the only place where people can go and get their care 24/7, regardless of who they are and their ability to pay. And that is basically the mission of healthcare in my mind. And that's the mission that drove me into the Cambridge Health Alliance eventually. I'm always innovative, always curious, always try to improve the environment around me, always try to volunteer and raise my hand about to do things that, are not necessary for other people to do. And that's what drove me into administration. One of the places that you can make a difference, in addition to caring for patients, and until recently I continued to practice clinically, is to be in a leadership position and try to make a difference. And that's what drove me into administration.
There's a lot to unpack there. Really a remarkable story, some of which I was unaware of. But you mentioned volunteering early on. I know that folks that volunteer a lot, they have those instances that they will always remember. Do you remember any of your early volunteer experiences as a child that kind of helped shape you and give you that drive?
Well, I volunteered with the Lebanese Red Cross as a teenager. I was 15. That was during, again, the Civil War, and you see a lot of really difficult scenes at that early age. A lot of situations that you could do very little about with the little skills that you have. And that was, again, another impact for me to grow in the field of medicine, particularly emergency medicine, to be able to make a difference for traumatic patients and people that are very unfortunate.
Well, it's certainly clear why you spend so much of your time giving back, feeling that so much was given to you. Thanks for that. That's really, I think, helpful to hear. Talk a little bit about, you mentioned being an emergency physician and the adrenaline rush that comes with that, but how does that shape your approach as a CEO? What lessons from the emergency department can you take into the C-suite?
Absolutely. Being an emergency physician, you have to learn to think on your feet and multitask, because you don't know what the next minute is going to bring. You can't plan your day. You can't plan your patient list. You can't plan their complications. And you could have a bus rollover down the street, and all of a sudden you're dealing with multiple injuries, and you have to be able to manage that without going on Google. I mean, those days there was no Google, looking things up and reading about them. You have to know what you're doing. You know, not only the adrenaline rush, but the ability to think on your feet. That's absolutely critical. So that was one lesson. But more importantly, putting the patient first. That is first and foremost the North Star. Patients first. The second piece, that's my other North Star, is do the right thing. Gotta always do the right thing. And working in the emergency department, you learn very early to rely on your team, because by yourself you can't do everything. And everybody in the emergency department, you have to work like a well-tuned orchestra for things to do well. Otherwise, there were so many opportunities for things to go the wrong way. So teamwork, do the right thing, and putting patient first.
You know, you have, when you talk to you at MHA or about other things relative to COVID, you really do have this infectious spirit about you. I know the term bedside manner is so often overused, but how do you keep that temperament and that positive attitude all the time?
It's something you're born with. You always have to look at the glass half full. I mean, in my mind, the glass is 99.9% full. It's not even half full. And you always have to look at the bright side. There's always a bright side to every single situation. And if there's no bright side, you make the best of it. If we roll back and keep looking at the past and keep looking at why things don't work and dwell on that, we're never gonna succeed, and we're not gonna progress to the next level. Always look to the future. I teach my kids and all the people that I speak with, spend very little time looking back. Live your present and think about the future as much as you can. That is basically my philosophy.
I feel we could just stop here and wrap it up. I'm going to throw my coffee away. I don't feel like I need caffeine. I am charged for the day. But let's talk about CHA a little bit, because obviously that's now the organization that you lead so well. It's a funny name. It's a health alliance, right? We don't see many of those. What does that mean? What does it mean to you? What does it mean to the community that it's Cambridge Health Alliance?
The Cambridge Health Alliance is an organization of the community, for the community, by the community. We have 12 healthcare centers out there and 3 small hospitals. But our work is different than most other organizations. It is facing the community. Most of our work is in primary care and behavioral health, business that doesn't pay very well. We do very little inpatient care, almost no tertiary and quaternary care. All that complicated, high-paying medicine, we send to our partners out in Boston, and we're an affiliate of the BILH, Beth Israel Lahey system. And they do great work. They are our clinical and academic affiliate. My academic position at Harvard is through the BI. And they really share the true culture and philosophy and the mission of the organization. But to go back to the Cambridge Health Alliance, the alliance was structured to serve a vulnerable community. We're the only public healthcare system in the state, and our mission is slightly different to everybody else. I know every healthcare system has the right mission. I've worked in many of the amazing organizations in the Metro Boston area, and I'm proud of that. But the Cambridge Health Alliance is unique, that everybody that works in the alliance, I said it many times and I say it again, drinks the Kool-Aid. Everybody here drinks the Kool-Aid. Everybody here is for the mission, is for the right reason. And just about everybody that works here has opportunities to work anywhere else, doing easier work, probably making more money, but they choose to be here. It is a choice, and it is a choice to work in the organization, being out there in the community. We started paying attention to social determinants of health way before that that sentence had even a definition 20, 30, 40 years ago. Paying attention to people's lives out there, where they live, how they live, where they get their food, what affects their health outside the hospital environment, bringing care to the patient's homes, to the patient's bedside, and paying attention to what matters. That's what makes us an alliance.
So it's certainly unique, and so let's talk about those patients outside of the alliance in the communities that you serve with all the health centers, the hospitals. It's a diverse group, and you more than anyone know that the pandemic has disproportionately impacted people of color. How has CHA accounted for equity as you've mounted your response to the crisis? And do you see this level of discussion around equity and doing the right thing in regards to health equity continuing into the future?
Absolutely. Again, with the organization's mission, this is work that's core to the organization years ago, from the date of its inception. It is not something that we woke up one day and we said, well, this is something that we need to do. It is something that is infused in the core of what makes this organization what it is. Related to the pandemic, very early in the process, we have a very, very strong multicultural department that oversees the communication and the contacts with the community and the interpreter services. We have a very, very active community department that interfaces with the community through a lot of services and a lot of grants to really bring the needs to the community. And we leveraged the strength there very, very early to provide a lot of education, a lot of information out there, mass to the community, training, etc. We were the first organization to establish drive-through testing in the whole state in early March of 2020. And today we're probably the last organization that still operates a mass vaccination center in Somerville that is out for anybody in the community that can come and get vaccinated everywhere. The state closed theirs a while back. Most organizations closed theirs. They're doing vaccination in the clinics. But in addition to vaccination in the clinics and in our pharmacies, we still operate a mass vaccination center in Somerville. We bring our care to the patient's bedside and to the community's bedside. We go to multiple events every week, whether they are at faith organizations or community functions, and we bring our educational material, we bring our food, we bring our vaccines. We're out there engaging the communities with their language, in their own principles, and that's how you really do the work. People need to see value to be engaged, and we try to bring value to the patients out there.
So you've been a leader for a long time in focusing on underserved populations. It didn't just come with COVID, although that has shined a light upon it. Do you have advice for other caregivers to continue to fold equity into everything they do as providers?
Absolutely. I truly believe that by paying attention to equity, not only you'll be doing the right thing, but also you'll be serving the whole community. We all know that the health of every subsection of the community affects everybody. If you don't treat everyone and care for everyone and bring health to everyone, the whole community health is going to go down, whether it is related to COVID, because the virus doesn't make a U-turn when it gets close to the haves. They get infected the same as the have-nots. And if we don't treat everybody and make sure that everybody practices appropriate etiquettes and gets vaccinated and gets tested, nobody's immune without this. So we have to treat everyone. And that's a good example that impacts healthcare and everything else. If we don't bring food, housing, transportation, you name it, and most importantly, lately, digital health, to all the population, that's going to affect us. So it is the mission of the leadership of healthcare to pay attention to equity, and to bring equity. It's not equality. bringing equity means paying more attention to the have-nots than to the haves, because the gap is so wide in there.
Right. Yeah, that's a really critical point. Thanks for saying that. You know, there's so much. You started in early 2020, and obviously we all know what the past 20 months have looked like. And there's so much that I think we as a Commonwealth are proud of you for. Your role in COVID, the way you've tested, the way you vaccinated, the way you opened clinics, the way you served your population, took care of your community. But is there something you're proud of? Is there any accomplishments that we may not know of that you feel great pride in when you think over the last year and a half?
Yeah, interestingly, I was picked as the CEO about 3 weeks before COVID hit. So talk about baptism by fire. But you know what? You do
your positive attitude a little bit. Right?
You know, you do what you got to do.
Yes.
And you know what? You just roll with the punches and wake up the next day and say, okay, what do we need to do to best serve? And you know, being an ED doc really helped. And my background is in disaster preparedness, so that's work that I've been practicing for years. But specifically, in my mind, our current second pandemic, not only in the region or in the state, but nationally, is behavioral health. And it is not a secret that we do have a disaster right now that we need to face, and we're trying to face as a community and as a healthcare community. A week ago, Monday, we had 42 behavioral health patients boarding in our emergency departments. 42 in our emergency. 63% of our beds were occupied by behavioral health boarding patients. And we're still taking care of everybody else with whatever space and resources that we have. This is not unusual. That same day, there were over 400 patients boarding in the whole state.
Yeah.
Days. We have kids boarding for weeks in the emergency department. These are kids that already have behavioral health issues, no resilience, and we put them in the worst environment because there's no place for them to go. One of the things that we worked very hard is to double down on our mission. And in partnership with the state, we are on track to revitalize Somerville Hospital, which was basically turned in 2009. We turned it into mostly a administrative building. We bring it back to life to be a hospital. And we are adding 69 child behavioral health inpatient beds at the Somerville Hospital. The first unit opened a couple of months ago, and the rest of the beds will open by April. This is not going to be a solution for everything, but it's a step in the right direction.
Yeah, it's going to take a lot of steps. So thank you for doing that. You have been tremendous. The state has been tremendous, and we're not there. You know, last Monday we had almost 700 boarders, and we all know that's not good care. And we need to put all of our collective energies and talents into that epidemic in order to solve it, because we have the minds in this state to be able to do it. And we have the leadership at the state level that's demanding it. So thank you for that. You know, I want to just ask a personal question here as we get towards the end and towards Q&A. I know you draw inspiration, motivation from other things happening in your life. You have a new addition into your family that I know you may be way too young to be your grandfather with all that energy, but how important is that role for you, and how's that going?
Unbelievable. Family is number one. And I'm so blessed that I have my first grandchild, baby Yara, 4 months old, born at the Cambridge Health Alliance, Cambridge Hospital. And she brought me back 20 years. And I have to see her every day. 3-4 days I have to sort of go visit my daughter, bathe her and change her and feed her and rock her to sleep. It's what keeps me going these days. And she is amazing. And, I wish this feeling to every single person. I mean, obviously, I had a similar feeling when my kids were young, but I was so busy during those days, working 24/7. I'm fortunate that my wife gave up her career when our kids were young, and she's back now doing very well, better than me. Now I could really enjoy my grandchild, and I hope we have many more. So that's my joy these days.
Well, that's awesome. And yeah, I'm sure you're just as young as you were before, but maybe with age comes perspective, and maybe you can appreciate it and enjoy that time. So that's really good to hear. And I hope if folks have questions as we're coming to a close, we'll get a few in the chat here. Now, I have a question. I've learned a lot just from our few moments together, but we always ask our guests, what's a piece of advice you can give some of the emerging leaders that are listening this morning and how they break into today's healthcare landscape and become successful?
I could share my experience. My goal was to do the right thing all the time. And that really bore positive outcomes for myself. I never thought of how can I, progress myself. I always pay the attention to the work around you, support your team, support the people around you, do the right thing, put the patients first. And also, we need to do less competition and more collaboration. There's so much out there that we need to do. We don't need to compete. There's plenty to go around for everybody. My advice is we need to lockstep, and we need to do what we need to do, and get organized with organizations like MHA, COBTH, and our organization, working with the state to really pay attention to what's needed out there. Equity, bringing care to the patients, being out there, and good things will happen to you if we do this.
I guess it's been an awfully difficult 20 months for all of us, but I think the things that you talk about, when we emerge from this pandemic stronger, I think the words that we've heard so often, maybe the 3 words, if you did one of those charts that shows what people are talking about more than anything else, have been collaboration, patience, and equity. And if our system emerges talking about those 3 things, obviously the improvement is immeasurable as we continue to move together as a healthcare community. So our time together, Dr. Sayah, is coming to a close. I want to thank you for taking the time to be with us this morning and sharing some of the things that make CHA such a special place to receive, deliver care, and even from what you said, to work. Look forward to following your work and your team as we all work to build a better, more equitable healthcare system. Thank you again to E-Inc., to all of our sponsors, and to you, our attendees, for being part of today's Executive Insight series. Dr. Sayah, thank you very much.
Thank you, Steve, and thanks for your invitation. Great work. Keep up the great work.
Thank you, and you too. MHA offers great programming on a weekly basis, and we encourage you to visit our website for more information on what we have in store. You can join us for our next Executive Insight session on October 28th, when we will be joined by Dr. Ann Kablansky, President and CEO of Mass General Brigham. And we also encourage you to mark your calendars for MHA's upcoming annual Women Leaders in Healthcare Conference. This is a special event for us every year, and we already have some incredible content lined up for you. Stay tuned for more details and make sure you register today. Thank you again for spending your morning coffee or your decaffeinated tea with us today, and I hope you have a great day. Thank you.